You know, a lot of people struggle with back pain, but some don't respond to traditional treatments. I've got my friend right here that knows all too well about it. And that's because the pain originates from the nerves within the vertebrae. It makes it a lot harder to get relief. And now there's a new, minimally invasive option that is helping people who have had to live with constant nagging pain for years.
That pain can be so bad, it wakes you up in a dead sleep with tears in your eyes.
Gene Forrest has dealt with back pain his entire life.
I had to start out wearing leg braces to learn how to walk. Found I had a curvature of the spine. So when I was in my freshman year of high school, I had to wear a back brace from my waist all the way to the base of my skull.
Over the years, that pain intensified, and his job as a mechanic and painter really took a toll on his body. He says he's had everything from a bulging disc and pinched nerves to a slipped vertebrae and sciatic pain down both legs. At low points, he couldn't walk to the kitchen or bend down to tie his shoes, and nothing brought relief.
I've done injections, I've done physical therapy, I've had surgeries, I've done massages, I've done acupunctures, I've done medications, and none of it worked.
He says the new Intracept procedure was his last resort.
I'm glad you're doing so well.
Dr. John Smirniotopoulos at MedStar Washington Hospital Center was the first physician in D.C. to do this nerve ablation procedure. On Gene, he used real-time X-ray imaging to zap a nerve in his back with radiofrequency heat.
And then a needle goes from the skin into the bone itself. Once we're inside the bone, we use a specific type of tool to curve in the bone to where the basivertebral nerve lives. Then we use radiofrequency heat to destroy the nerve. Patients can walk away with Band-Aids, no stitches, no sutures.
With a single treatment, the procedure can precisely target damaged, even deadened and inflamed nerves in the lower back, relieving pain in the weeks to come.
We see this where patients are getting to a point where their pain is so bad, they are restricted to their couch or their bed. They can't function. They can't take care of their families. In his case, he was legitimately not going to be able to work. And being able to treat him and get him to the point where in follow-up, he's actually at his job talking to me, that to me was the best thing to see.
Although it's not a cure, Gene says he's pain-free about 70 to 80% of the time, and back to doing what he loves.
This procedure saved my career. It saved my way of life. It gave me back a lot of things that I'd lost.
Thankful for the technology and hopeful about the road ahead. The Intracept procedure is done as an outpatient procedure and lasts about an hour. As with any procedure, there are potential risks, which include the possibility of irritating an adjacent nerve, bleeding, or infection. And to qualify, patients have to meet certain requirements, and they need an MRI imaging to make sure that they are a good candidate for it. But
wow,
you can tell by his story, it's clearly done wonders for him.
If you've ever been awakened at night by back pain, you'd be willing to take whatever risk to do something like that, to get relief.
Clearly, he's tried just about everything, as so many back sufferers have. So again, you do have to meet some certain requirements, but it is worth taking a shot.
Okay,
Absolutely.
it's worth a